My name is John Kelly. I'm the publisher of the Orlando Medical News. Today we are blessed to visit with Dr. Elisa Maria Bianchi, MD. She is a colorectal surgeon practicing medicine in Orlando, Florida, with the Digestive and Liver Center of Florida. She is a board-certified general surgeon who completed colorectal surgery fellowship at the Zucker School of Medicine at Hofstra Northwell Health in New York. Her specialty training encompassed a variety of small bowel, colon, rectal, and anal pathologies, which included malignant, benign, and inflammatory disease, such as Crohn's disease and colitis. Dr. Bianchi completed her general surgery at Loma Linda University Health with an emphasis on robotic techniques. She completed her medical training at the University of Illinois at Chicago. Dr. Bianchi's resume is extensive, but what is really important is the principles that she provides herself on. That is, developing a close rapport with her patients and making sure all medical options, not only surgery, are explored to optimally treat the disease. Welcome, Dr. Bianchi.
Hi, thank you.
Dr. Bianchi, what is your specialty?
I'm a colorectal surgeon.
Can you briefly explain for our audience what a colorectal surgeon is and does?
Yes, as you mentioned a little bit ago, so colorectal surgery is a specialized field within general surgery that focuses on the surgical management of benign and malignant diseases that include the small bowel, the colon, the rectum, and the anus. Some of the benign diseases that we deal frequently with are diverticulitis, hemorrhoids, anal fissures, and then some of the malignant ones are things like colon cancer, rectal cancer.
Wow. When would you suggest a patient seek medical advice?
Well, I would recommend that any time that someone has any sort of rectal pain, any rectal bleeding, or they feel any abnormal discharge or any bumps, they should definitely seek medical advice. Specifically, I would recommend for any rectal pathology that they see a colorectal surgeon, because it's a very specific and specialized field, and many doctors are not familiar with that area, because obviously it's not a very comfortable area for patients to talk about, and it's not very comfortable for most doctors to deal with. So I would recommend that, again, anytime, any sort of pain, bleeding, they should get checked, just to make sure that there's not something concerning that should be treated, such as cancer.
Wow. Now, you had shared with me in earlier conversations that you do surgical procedures on anal fissures. What exactly is an anal fissure?
So an anal fissure, it's a linear tear in the anal canal. So if you want to compare it to something that people are familiar with, like for instance, if you have a cold or dry lips, when you get a cut on the corner of your mouth, you can think of that as happening in your anal area. So it's kind of the similar idea. So it's a very common benign and rectal disease that we frequently see. And one of the common things that it causes, it's anal pain and anal bleeding. And then most of the patients that I see in the clinic that come in with hemorrhoids, a lot of them have fissures when we actually examine them.
So what is the age group that most commonly presents anal fissures?
So we actually see it in a variety of people. I mean, I see it anywhere from like teenage to older people. This week, I saw a 20-year-old and I had a 75-year-old that had fissures.
Those have to be two very different conversations. So what is the root cause of an anal fissure?
So usually it is very common that the majority of them are caused by a primary issue caused by local trauma. And what I mean by local trauma specifically, it's the trauma from a passage of hard stool, usually due to constipation. But it can also be caused by having frequent bowel movements during a diarrhea episode. It can be caused after vaginal deliveries or from anal sex. There are other causes that also can give you fissures, but they're a little less common. But this include inflammatory bowel disease. It can be caused by cancers or sexually transmitted diseases too.
What are the clinical symptoms that would present themselves?
So usually patients complain of anal pain that it's often present at rest, and it's usually exacerbated after having a bowel movement. And the pain, it is frequently described as stabbing pain, and it can last anywhere from minutes to hours after you have a bowel movement. Anal fissures can also present with anal bleeding.
What type of treatments are there for anal fissures? I mean, does everyone require a surgical procedure, or are there more conservative solutions?
Absolutely. So the most of the time when someone presents with an anal fissure, we usually try to treat it medically. So our first step is to do the treatment non-surgically. Usually we try this management for about 4 weeks. The medical management includes talking about increasing fiber. I normally tell patients to take a daily fiber supplement and increase their water intake to 6 to 8 glasses of water a day. It has to be a behavioral modification. In addition to the increased water and fiber, I also recommend that patients do warm water sitz baths for 20 minutes 3 times a day. And then I'll prescribe a cream composed of 2 medications. One of them, it's a lidocaine, which numbs the area. And the other one, it's diltiazem, which actually helps the anal sphincter muscle relax. And the goal of this is to relax the sphincter, to improve the blood flow and heal the fissure.
Is it fair to say that the American diet or the U.S. diet, and I only offer this because you had talked about fiber, but is some of this related to diet?
Absolutely. The fact that most of our diet doesn't have a lot of fiber, like when you eat a lot of meat, potatoes, those things don't have a lot of fiber in it. And everybody reacts to things differently. There are people that can have that diet and don't have issues, but I will say that the majority of people have an increased risk of constipation because of our low fiber diet for sure. It's hard for people to make big behavioral changes. So that is why a more realistic thing is to actually make the effort of taking a fiber supplement. Because it's not going to be easy for someone to go from eating meat and potatoes to then become a vegetarian. So it's just much easier to just take a fiber supplement during the day, just once or twice a day, and then increase your water intake than to just drastically change the way that you eat.
So what percentage of your patients actually have to have a surgical procedure?
I would say that for my patients, it's probably a minority because I spend a lot of time counseling the patients, making sure I explain to them how to take the fiber, making sure I talk to them about the importance of doing the sitz baths and the cream. And if people follow the instructions, most of them do well. I mean, I have to say that there is some minority of patients that actually will require surgery, but if someone doesn't make the behavioral changes, then things are not going to change.
Well, this has been interesting, Dr. Bianchi. How can our audience contact you if they would like to discuss these issues with you?
So the way to do it, they can actually call our office. The phone number, it's 407-384-7388, extension 5. And they'll talk to one of our nurses and they can schedule a visit for them. We're pretty flexible. And like I said, it's always good to get evaluated for any sort of rectal pain or bleeding.
Well, doctor, I know how busy you are, and we really value the time you dedicated to us today. Thank you very much and have a great day.